When we have an environment where there is too much sugar and refined carbohydrates, we have a population whose insulin levels on average are much, much higher. Because insulin obviously is produced in response to sugar and carbohydrate intake.
Mm-hmm.
Insulin signals on the same cell as of the hypothalamus that leptin does. So it has a joint signal. The more insulin you have, the weaker the leptin signal. So you have this situation in populations in Western societies with highly refined food and high sugar foods, where they have high leptin levels. They are fat. They have far too much energy on board. But because their insulin levels are so high, that signal is being obscured. So your brain can't see it. It can't tell that you're carrying too much weight. And this is a thing called leptin resistance, which is what happens with end-stage obesity. And it's not just insulin that causes that. It's the other thing that you mentioned, inflammation. So inflammation is a secondary effect of obesity. So every person who's obese will have a low-grade inflammation in their body. And this produces an inflammatory factor called TNF-alpha, which has been shown, one, to interfere with insulin signaling. So you need more insulin, which can affect the leptin at the hypothalamus, but also has a direct effect on inflammation in the hypothalamus, and again, poor signaling. And this situation where your leptin levels are high, but actually your brain can't sense it. And the great analogy in the book to help people understand is like if you're driving along the highway or the motorway, and you see that your gas tank meter, your petrol meter is on empty, it's flashing. You start panicking. You think, "Oh God, I've got to fill up." So you look for the next petrol station. When you open the tank and start to fill up, you realize it's already full. The problem is the gas tank meter, the petrol meter, is broken. And this is what leptin resistance is. This actual feeling of being hungry, this feeling of having an empty tank, but actually having a tank that's far too full, having an oil tanker's worth of energy on board when you feel like you're on empty. That's what leptin resistance is, and that totally explains obesity.
Yeah, I was going to say, I mean, as you circle back to your obesity vulnerable types and your obesity sensitive, obviously this just amplifies everything, doesn't it, in terms of...
Yeah. And it's a scary condition. I mean, obesity, obviously I've spoken to thousands of patients with it from a very objective point of view, because I'm from, my dad's skinny, whatever. I got the way on. So very, very objective, having never been on a diet. Actually, this is quite a scary condition, not being able to get out of it, transiently being able to step out with some really, really calorie restrictive diet or whatever, but actually always being pulled back to that weight set point and that, societal perception that there's something wrong with you. Why can't you pull yourself together? Why can't you go on a diet or eat proper food and or go to the gym? And this is something that's affecting a third of our population. It's causing terrible, unhappiness and ill health. Type 2 diabetes, blood pressure, cholesterol, and things.
Yeah, I mean, it's staggering. And as you mentioned, when the food environment is ultra processed around us and them, then it's, it just amplifies this. To your point, there's almost nowhere to turn, and we're predisposing now to all the chronic conditions, both physical and mental. And when we look at obesity, you also talk about obesity being a deficiency disease. Can you talk a little bit on the nutrition side? Does that type of diet, then that ultra processed food diet that people are struggling with, then lead to some nutrient deficiencies that can worsen or amplify what's going on there?
So there's a chapter in the book called, I think it's called the omega factor. And it talks about the omega-3 and omega-6 polyunsaturated fatty acids. And we're sure we've all heard of, omega-3 is supposed to be good for you. A lot of, some labeling says omega-6 is good for you, but they're both basically essential fatty acids, which means we can't produce them. And it's basically like the same as a vitamin. So if we don't have them in our diet, we can't produce them, so we can actually get some serious diseases. So it's a little bit like vitamin C, and indeed examples in the book, vitamin B1, so with thiamine deficiency causing beriberi, or vitamin C deficiency causing scurvy. So these are the sort of historical examples of diseases that were there hundreds of years ago. A lot of research was done on them, but people didn't realize they were a deficiency. There was a lot of different explanations, So this chapter of the book looks at, is maybe obesity caused by some sort of deficiency or disruption of some sort of essential vitamin or fatty acid that we don't fully understand yet. And the whole chapter is a hypothesis, but I really do think that it's sort of on the right lines, and I think it may be proven in the future, because we know that populations who have Western foods, it's not just the sugar and the refined carbohydrates, but it's also the fact that the food has to be industrialized. It has to be stable. It has to sit on shelves for weeks and months on end in order for it to be profitable for food companies. Mm-hmm. And in order to do that, you have to take the omega-3 out of it, which is something that makes food go off. It's in fresh foods, in vegetables and meats and fish. And you have to replace that with omega-6, which is in pretty stable foods, so nuts and things like that, things that don't go off so much. And when we look at the omega-3-6 ratio in our cells, because omega-3 and 6 are very essential in signaling in our cells, the ratio in Western populations is massively disrupted. So we should have a ratio of about either 1 to 1 or 4 to 1 omega-6 to 3. But actually, in quite a lot of Western societies, it's 20 to 1. So we have a massive increase in omega-6 in our cellular sort of really important messaging part of our cells. And omega-6 causes inflammation and it causes disruption of insulin signaling, whereas omega-3 decreases inflammation and improves insulin signaling. And the hypothesis is that, if you infuse Western population's diet with omega-6, vegetable oils basically, that population will increase their insulin, increase their inflammation, get leptin resistance, and become obese. And when you look at the epidemiology, it sort of seems to fit in. Yeah. So it's a sort of a hypothesis, and actually the book sort of expands into what happens with animals. So, for instance, I
mention some of the tests on mice that you mentioned in the book. It's really fascinating.
So not just mice, but hibernating animals. Mm-hmm. So what is a signal that a brown bear gets as winter is approaching to get a voracious appetite and, put on 30, 40 kilograms, in order for it to have that fat to last it through the winter? Well, actually, when you look at some of the evidence there, the type of food that there is available is more sort of nuts and seeds in the winter. And that can affect the omega-3-6 sort of ratio in brown bears, and that may be the signal. There is some other evidence that vitamin D or even sunlight may be some sort of a signal. But we don't understand these things. But we know that there's something in the environment in the autumn that will stimulate some animals, hibernating or tube-poor animals, to put on a lot of weight. We don't fully understand. But my hypothesis is that maybe there's something in the Western diet that actually also signals, in a way we don't understand, large chunks of the population to, put on a lot of weight.
Yeah, I mean, it's you see the omega-6s, as you mentioned, very pro-inflammatory, and when we see the amounts that high, almost also serving as a proxy for processed food intake, because we know, as you mentioned, they're full of omega-6s, and so we've got this high processed food, which is bringing on too much energy and bringing on too much omega-6, which is contributing to this whole milieu of inflammation. And the idea of lacking in nutrients that the brain would then stimulate appetite to try to obtain, whether it's the protein or various nutrients, seems pretty compelling.
The whole thing is, Mark, that the reason that our diet is infused with vegetable oils that are very stable, and also with sugars and refined carbohydrates, is this historical difficulty with saturated fat being linked with cardiac risk, which again is totally unpicked in the book. This research was biased and flawed, but so successful in changing the psyche of basically the whole world, associating, for instance, a juicy fatty steak with producing, furring up the arteries and cardiac risk, or, too much sausages or too much cheese or too many eggs. We still have this in our psyche. But actually this research, as is totally unpicked in the book, is flawed. And there is increasing evidence that natural saturated fats, from red meat and dairy products are not a massive cardiac risk, maybe a very small risk for some people with natural high cholesterol levels. But actually the real risk, cardiac risk, is sugar and refined carbohydrate, which increase triglyceride levels and give you the risks that way. Um, because governments had this wrong idea in the 1980s that saturated fat was going to cause their population to start dying up from cardiac disease, they gave us the dietary guidelines in the 1980s to reduce saturated fat and replace it with heart healthy vegetable oils, so flora, all of these rubbish margarines, totally artificial foods, and sugar and refined carbohydrate. They said whole grains, but no one really eats whole grains, and this is when obesity started taking off. From the 80s onwards, we didn't have a massive problem. Certainly when I was growing up in the 1980s, when I was in school, there wasn't a big problem in the early 80s. There wasn't a big problem with obesity. So it took off then. With those dietary guidelines, it was a little bit of a big experiment on public health, and it went wrong.